Today we'll have updates from the Lubbock Health Department, the local health authority, the Lubbock Police Department, and from the city of Lubbock. Today our panelists are Director of Public Health, Katherine Wells, Local Health Authority, Dr. Ron Cook, Lubbock Police Chief Floyd Mitchell, and Lubbock Mayor Dan Pope. So let's get started with Katherine Wells.
Good morning. Today I want to update you on our Lubbock case investigations and also talk about the new drive-through clinic that will be operated by the health department. Over the last week, there has been a significant decrease in the number of reported cases to the department. Currently, there are 499 confirmed cases, and we've seen really a drop over this last week. Since last Monday, we've only reported 68 new cases, and this is half of what we reported the previous week of 125. The number of recoveries is also increasing. This is really good news and shows that social distancing is working, and we need the community to continue to stay the course. This Wednesday, the health department is pleased to announce the opening of a 4th drive-through clinic in Lubbock. This clinic will be operated by the health department and will be located at the Patterson Library at 1836 Parkway Drive. The clinic will be open Monday, Wednesday, and Friday from 1 p.m. to 6 p.m., and it will be by appointment only. To get an appointment for this clinic, individuals will need to call the City of Lubbock Health Department at 775-2933. There will be some criteria to be seen at the clinic, and this is similar to the other clinics we see in the community. Individuals must have either signs and symptoms of COVID-19, so that includes fever, cough, shortness of breath, or they have to be around someone that has been a confirmed case of COVID-19. And then the third criteria would be we will see any individual who's a healthcare worker or who works with any of our high-risk groups. So that could include somebody that works at one of our retirement facilities or maybe works in a group home. There is no cost to be seen at this clinic. The health department will be accepting insurance. And if you do have insurance, we ask you to have your insurance card when you call to make that appointment. However, if you do not have insurance, there will be no charge for the testing. This will be a swab, a nasal swab, similar to what they're doing at the UMC clinic. And the results should be available in 24 to 48 hours. Again, if you want to get tested at this clinic, please call 806-775-2933. And we will be expanding clinic hours depending on need. But right now it's open Monday, Wednesday, Friday from 1 p.m. to 6 p.m. And the first clinic will be this Wednesday, April 29th. I'm going to go ahead and turn everything over to Dr. Cook. Thank you.
Thank you, Katherine. You know, this is wonderful news for the city and the community of Lubbock and our county. I want to reiterate all the hard work that everybody's done to stop and slow down this virus. What I do want to also reiterate is the fact that we're not out of the woods yet. We do not want a second surge of COVID virus and COVID infections in ill individuals where our hospital systems become overwhelmed. Today I'm making rounds in a hospital and things look pretty good. We cannot stop. We can't stop pushing forward to make sure that we're doing everything possible. So there's good news and bad news here. I know that the mayor is working in his group, the Economic Recovery Task Force, is working hard to make sure that we open safely. However, there are still some bad players out there. I have reports from bad players where they are forcing their employees to return to work even though that they're ill. They're showing up with symptoms, they're not wearing masks, and in that way, they're infecting their coworkers, they're infecting every customer that they touch or come in contact with. That is the way to make us step way far back and make us slow down and shut down the community again. I know nobody wants that, but if you're an employer and you're making your employees show up to work when they're ill and not requiring them to stay home when they're ill, and not getting them tested when they're ill, then this is on you. You need to stop that. I do have good reports of other individuals and other employers where they're screening employees as they come into the workplace. They're making them wear masks. They're making them answer the questions. Do you have any of the COVID symptoms, the cough, runny nose, abdominal pain, nausea, vomiting, fever, all those sorts of questions? And they're testing their temperature. They're taking a temperature check. And sure enough, there have been a number of reports that individuals showed up at work completely without any symptoms. They took their temperature and found out that they had a fever. The employer then sent them to go be tested, and they turned up positive. And then they sent them home not to return for 10 to 14 days. This is how we stop the virus as we open up the community. You've got to be vigilant and report symptoms. Employers must record temperatures. We've got to do this in order to stop community spread as we open up the community and get back and get our economic recovery on the road. So if you're ill, get tested. If you have a fever, get tested. Do not go to work until you're tested and have a negative result. That's all that I have. This is great news for everybody. I'm excited about this. We've decreased our number of cases by half over the last week. This is wonderful news. It was a beautiful weekend. It looks like it's going to be a beautiful week. Let's continue our hard work as we respectively open up our community and still be safe. That's all that I have. Lacey, back to you.
Thank you, Dr. Cook. Now for an update from the Lubbock Police Department, we have Lubbock Police Chief Floyd Mitchell.
Good morning. I wanted to go over the first quarter crime trends that we have seen in Lubbock during the first part of this year, and then we'll talk about specific crime trends that we've seen during the disaster declaration. So for the first quarter, January 1st through March 31st, crimes against persons are slightly up. We had 1,499 incidents in 2020 versus 1,485 in 2019. This is 10 additional or more than we would see in our 3-year running average. Crimes against property are up. We had 3,647 incidents in 2020 versus 3,348 incidents in 2019 for 144 increase or more than our 3-year running average. For the first 2 weeks of the disaster declaration, March 17th through March 31st, crimes against persons were down. We had 236 incidents in 2020 versus 304 incidents in 2019, or 68 less incidents. Crimes against property were also down during that 2-week period. We had 507 incidents in 2020 versus 639 incidents in 2019. For the first quarter domestic violence related calls for service, those were also down in the first quarter. We had 3,830 incidents or calls for service in 2020 versus 3,984 calls for service in 2019, or 154 less calls for service related to domestic violence. For domestic violence crimes against persons, these are assaults and things of that nature, they were slightly up. During this first quarter, we had 1,228 in 2020 versus 1,203 in 2019, or 25 more incidents. For domestic violence crimes against property, those also were slightly up. We had 140 incidents in 2020 and 124 incidents in 2019. Since the disaster declaration meaning March 17th through April 23rd, the DV related crimes against persons were 490 in 2020 versus 590 in 2019. So 100 less domestic violence related assaults during the disaster declaration. For property crimes during that same period of March 17th through April 23rd, property crimes were also down. We had 48 incidents in 2020 versus 64 incidents in 2019, or 16 less domestic-related property crimes. COVID-related citations. The police department has issued 39 COVID-related citations to date, and the fire department has issued 11 COVID-related citations for breaking the disaster declaration for gathering or social distancing. The one trend that we have seen year to date in Lubbock has to do with our number of homicides. To date, for this first year, we have had 16 homicides in the city of Lubbock. This is a significant increase, as we had a total of 16 at this for the whole year last year. So we are having our tag officers really pay attention to this, and our Metro Squad officers pay attention to this. The one I guess positive thing in this is all of our cases have a suspect identified except for one, and we're working to identify that. With that, we'll turn this over to the mayor.
Good morning. Thank you, Chief. Appreciate your numbers. Dr. Cook and Ms. Wells, thank you for your work also. So I want to start by talking about data this morning. Remember on Thursday, we told you that there's 3 key metrics that we are evaluating. We want to look at hospital capacity. By the way, that chart is not on our website, but it will be today. That hospital capacity remains strong. Okay, it's very good. It's as good as it was Thursday, if not a little bit better. We also are charting new cases, as you heard Ms. Wells talk and Dr. Cook elaborate. We've averaged less than 7 of those over the last week. We've got that number going, the trend is going the right way. And finally, we are looking at total active cases. Total active cases have remained flat. That's on our website. You can look at that, but they've remained flat, just under 300 total active cases. We believe that will start to go down, as certainly as we have fewer new cases and people recovering. So I think very good news when it comes to data. Okay, so what's next? We've got a group of citizens, the Lubbock Economic Recovery Task Force, that have been meeting since last Monday. They've really worked all weekend, all week long, really around the clock. They worked over the weekend. They will finalize their report to the city council this evening. We'll also hear from the governor this afternoon. We'll see what he has to say, and I'm certain that will be included in the report from our Economic Recovery Task Force. Tomorrow, our city council will meet and will consider these recommendations from our task force. We will we'll carefully consider what our next steps are. And I think it's important for me to remind you that we hear you. And I hear from those employees, those men and women who just want to go to work so they can put food on the table for their families. I hear from the smallest of our businesses, and so many of our businesses are 1 and 2 and 3 people, kind of businesses. We hear from you. We know you are hurting. We also hear from those that say, protect us, keep us safe, particularly from the family members of our most vulnerable, those that are in our adult centers, our nursing homes, and our long-term care facilities. So, it's important that we balance this. The data tells us that it's time to begin to warm up our business in phases. We phase it in. I think we can do this with the support. You heard Dr. Cook talk about it. We can do this with the support of our public health authorities and our healthcare experts. I believe that trust exists. Our efforts are working, and Dr. Cook elaborated on that, but we have accomplished some of the goals that we set out to accomplish 5 weeks ago. Thank you. Thank you for everything you've done. Now, we've got this balance that we must strike. We've talked about it before. It's lives and livelihoods. We value both of them. We don't want to sacrifice soon safe for soon. Okay, we don't want to go too quickly. But I believe we can finish the race and stay the course. That is, get business going and remain safe. And I want you to keep your eye on the prize. Let's celebrate Independence Day on 4th of July. Let's send our kids back to school. Let's make sure Texas Tech opens in August. Let's enjoy Friday Night Lights. Let's gather at Jones Stadium for football games. We've got to stay strong, Lubbock. We can do this together. It's that West Texas spirit that we've got to summon. Be safe, be kind, be hopeful. Thank you.
Okay, now we'll open it up for media questions. So if all the panelists will start their video. Our media order today is Terry Furman with KOBK, Matt Dotre, the Lubbock Avalanche Journal, Adon Rubio with the Daily Toreador, Karen McKay, KCBD, Olga Aguero with El Editore, Matt Stell with KMAC, Christy Martinez Garcia, Latino Lubbock, Tori McGee, Fox 34, and Jonathan Seaborn with Texas Tech Public Media. So let's get started with Terry Furman.
Yes, good morning, everyone. I wanted to ask about, with the governor talking today, this is probably for the mayor, he's expected to release certain dates to reopen restaurant restrictions, hair salons, and possibly even gyms. Now, would the city of Lubbock follow these guidelines, or do we have a right to say there are certain businesses that will not reopen despite what the governor says?
I would imagine that the governor's advice and orders would be very seriously considered by both our task force and our city council. I don't want to speak in hypotheticals about what he will and won't do today. He's been very careful to say that he thinks it's important that we reopen business, but that we do it in a very safe way.
Okay, thank you.
Thanks, Terry.
We have Matt Dotre with the Lubbock Avalanche Journal.
Thanks, Lacey. Hey, everyone. Dr. Cook, I'd like to get your thoughts on this. What are the concerns with opening up too soon? And do you think Lubbock is ready to start pulling back some of these restrictions?
Let me answer the second one first. Matt, yes, I think the city's probably ready for that, but we must do it in a measured manner. Just like the mayor said, we've got to be careful. One of the health department's job is touching base with all the other healthcare providers, including the hospitals. My biggest worry is that if we don't go out and play nice, we don't play by the rules that we're going to set forth, that there will be a surge of cases. And then if we see a surge in cases and it's starting to tax the hospital systems and being able to care for all of our people, our citizens in Lubbock, then we're going to have to roll back the carpet a little bit and take another run at it and get it calmed down before we take off and open up again. So that's my biggest fear for the city, the health of the city, is to make sure that we open slow enough that we don't cause a sudden increase. A lot of that depends on how well our citizens pay attention to what we need to do to not spread the virus.
Those bad actors you were talking about, those businesses, are those businesses that citizens are visiting or shopping at?
Currently, yes.
And if so, I mean, could you name names? I feel like citizens.
I don't know that that's important. I think the important thing is to make sure, because we've taken care of those instances when they do occur, but also, putting forth things like screening employees as they come in, making sure they don't have a fever, asking those questions, assuring and reassuring the employees that they do not and must not be there if they're ill. That is one of the most important things to stop the virus. If you're ill, please stay home. And then if you're not ill and we don't see a temperature, but you may be shedding virus, that's the whole thing about wearing a facial covering, is that you're not spreading it to somebody else.
Okay, now we have Adon Rubio from the Daily Toreador.
Hello, everyone. I guess my first question is in regards to the I guess last Wednesday's special called city council meeting, you guys discussed the revolving loan fund program. And I know one issue that was spotlighted was the fact of informing citizens about this program and needing to inform almost all businesses. So at this point, what are some of the city's efforts to continue informing people about this program opportunity?
Mayor, I'm sorry, you're muted.
Don, thanks for your question, and really thanks for continuing to shine a light on this. We've had a remarkable amount of traction on this effort. In fact, we'll get a report tomorrow at our council meeting on exactly where we are, but the word did get out. You guys were a big part of that, so thank you for your help. It's critical that our smallest of businesses, many of whom are not taking advantage of or are able to take advantage of some of the federal efforts, are reached and by this. And I think we've had some success, and I look forward to hearing a little bit more about that tomorrow. But as of Friday afternoon, we felt like we might even be getting very close to the limit of what we put in the initial funding.
I guess just as a follow-up regarding tomorrow's city council meeting, you guys will be discussing possibly extending the disaster declaration rules. So is there a possible date you can give us as of now if you guys were to extend that declaration? We've not talked about dates. I think I think what you might see from us is an effort, as I talked about, to restart, to phase in, warm up our business climate. But at the same time, I would not be surprised that if that order still had some public health assumptions, directives in it around numbers of mass gatherings, particularly around our vulnerable populations. One of the things we know more and more every day is that this virus has a significant impact on people over the age of 65, and all we can do to keep them safe, I believe, is top of our list.
Okay, next we have Karen McKay with KCBD.
Good morning. My first question is for the mayor. Dr. Cook said a moment ago that some employees are not wearing masks, and I've noticed that also in some restaurants. But it hasn't really been clear, Mayor, is that a suggestion or an order for employees in particular to wear masks, or anybody in general, but especially, say, restaurants, grocery stores? Is there an order there to wear masks?
Not currently, no.
Are you considering that?
I think our task force is considering it. They certainly are, and I think more and more citizens are going to vote with their pocketbooks and their heart, from a standpoint, do I feel safe before I spend my money? And I think masks are probably or face coverings are probably very important for our restaurants.
And can I ask Katherine a question about the nursing homes? Is that situation under control, especially with Whisperwood? We were seeing some other instances of employees traveling to other places, or are you still investigating that?
With Whisperwood, we've completed testing of all individuals at the facility. We'll continue to monitor that. There are individuals who are infected with COVID at that facility. We're also seeing some individuals being released from isolation and are going to do well. So that's definitely on, something that's on our radar, and we continue to work with any nursing home in the community that has any case. We want to identify those cases as soon as possible and work with them to stop spread.
Now we have Olga Guerrero with El Editor. Olga?
Good morning. I just, I've been kind of concerned as what Karen McKay was saying about the masking and I remember a while back I had asked Dr. Cook if he felt that maybe checking temperatures of going in any essential business. But would that be also considered, especially when we consider reopening? Because you wouldn't want your employees or the employer to enforce checking temperatures, but yet having customers going in there with the temperature and you wouldn't know it. That, and then the medical personnel, are they being tested, especially if they're working like at a nursing home or a rehab center? And the reason I'm saying this is because I learned over the weekend that there was a lady that had passed away, who's a grandma. The grandson was being left at her home. That's how she caught the coronavirus. And it was because the child was a carrier to the grandma. The mother of the child was working at the nursing home. So I think the health providers, they have to be tested, or am I wrong?
I'll answer that, Olga. Yes, they are. They should be. If you can see my badge right here, this little gray dot means that I got my temperature tested and signed in that I didn't have any of the COVID symptoms before I could make rounds in the hospital today. So yes, they should be.
Next, we have Matt Still, KMAC.
Thanks, Lacey. Our first question is for Chief Mitchell. Chief, it's good to see you on these calls. My first question for you is, I'll just say personally, and kind of on my routes when I go to work to the station in certain places, I typically see every once in a while some of your officers, checking for speeding, conducting traffic stops. Has the department stopped that temporarily? And is it due to the pandemic, or is it just you've moved them over to certain, more areas of importance in the city, or has just traffic stops and giving out speeding tickets and speeding citations stopped for right now?
Well, traffic enforcement and crime reduction efforts have not stopped. I want to make sure that's clear. What we have done is we ask officers to use, one, their common sense and their judgment and officer discretion. Part of that is if you see someone going 5, 6, 7 miles over the speed limit, use your discretion. Do you need to stop this person, or can you, ride up next to them or hit your lights and sirens and get them to slow down? We're trying to do our part by reducing the number of contacts we have, so we don't lose officers by contacting people who are infected. One of the big things that we've done since this started is I put out a special order early on, giving officers, one, making sure they had all their personal protection equipment, and making sure they used, instructing them, use your discretion, try to get voluntary compliance, whether that's speeding or any other minor city violation of city municipal ordinance. But if they are creating a hazard, or if they're breaking the law and they need to go to jail, we're going to do what we need to do to put those folks in jail. But just like I've said before, everyone doesn't need a ticket to get the message to slow down. Everyone doesn't need to go to jail to get the message to slow down. So we are giving the officers, or make sure the officers use their discretion in regards to how they are enforcing the laws. But if they are violating or committing a criminal act, then we are arresting those folks. Hope that answers your question.
It does. Thank you. I got one more question. This may be for Ms. Wells. If I heard you correctly, Katherine, you said that the testing center at the Patterson Library, those folks will have to set up an appointment to get tested or screened there. Is the rapid testing, will that rapid 15-minute testing be available at the Patterson Library like it is at the Friendship Football Stadium?
No, the rapid testing will not be available. That's very limited machines. And we're very lucky that Covenant was able to get those machines here in Lubbock. But like the other drive-through clinics we have, it will be a nasal swab, and then it will be about a 24 to 48 hour turnaround. We will be using the same laboratory as the UMC drive-through.
Now we have Christy Martinez Garcia of Latino Lubbock.
Good afternoon, everybody. Do we have a plan in place if we begin to see a second round of cases that includes testing? Katherine?
We will continue to have these 4 testing sites up as long as they're needed, especially the city one, and I anticipate the hospitals to continue with theirs. I think we're very lucky in this community to have 4 drive-throughs, and I think we've nicely have them dispersed geographically. One down in Wolfforth, UMC out in 108th, I think, is where the Walmart one is, and then one on the east side. So I think there's a lot of testing capacity here in the community.
My next question is, the Lubbock Economic Recovery Task Force was formed and includes, quote, C-level people, CEOs. As this, end quote, as the city does recover, will you consider forming another committee to analyze the pros and cons of how COVID-19 has been handled locally with consideration of E-level, essential, and F-level frontline folks?
Well, first of all, I don't know where the C-level comment came from. That was not from me. The task force includes social service. It includes small business owners, restaurateurs or businesses who've closed except for drive-through or curbside. It includes medical professionals. It includes certainly business leaders in our community. I believe that it's a very comprehensive group that represents a tremendous amount of our community. We also have a set of experts there, and most importantly, they've listened to testimony from a number of our people who've been most impacted by this. They're not a member of the committee itself. I'll give you a couple examples. Childcare. I know that one of the chairs of our group spent quite a bit of time with a couple that own a number of childcare facilities in our community, and they wanted to share what they were doing and some of their concerns and how they thought they could safely navigate through this. Another example is our salons. We've heard loud and clear from a number of the salons, including I know a couple conversations with at least one owner, maybe more than one. So we're getting a lot of input. They are getting a lot of input. I believe I get input pretty much constantly. I share that with them. I believe that everyone's being represented. Young, old, frontline, people that have to sit in an office. I believe I don't really distinguish between that. I think about how we move our community forward and how we do it safely and how we get our business restarted.
And we're going to move on to Tori McGee from Fox 34.
Good afternoon. This question might be either for Dr. Cook or Mrs. Wells. Since testing has increased, did you expect the daily number of positives to drop like it has over the past week?
I think I can answer that. No, I'm pleasantly surprised, and I'm excited about that number. So, no, I expected it to take a little less of certainly a slower slope than what it did. It's dropped way off. I think this is fantastic news, but I did not expect that.
And this question will be for the mayor. Since the governor has a strike force focused on reopening the state, and he's expected to announce those plans later today, what is the role of the local task force? What's different between what the state has in place and any local guidance or ordinances?
Yeah, thanks, Tori. If you don't mind muting your phone, we're getting quite a bit of echo there. I'd love to answer your question. The governor's been very clear that there will be regional considerations in reopening Texas, I think is his word. And he's encouraged us to be working at the local level. Remember that the world we're going to go back into slowly is not the world that we left. We're going to do restaurants very differently. We're going to do our gyms differently. We're going to go to the barber very differently. So it is important that we have local work to make sure we work with our businesses, our not-for-profits, our families, our healthcare facilities to make sure that we do this the right way. And so I think it's both and. I don't think it's an either or.
And finally, we have Jonathan Seaborn with Texas Tech Public Media.
Hi, so this would be for Dr. Cook or Ms. Wells. With the recent downward trend in cases, how big is the concern around people relaxing social distancing practices due to like a false sense of security?
I do have concern about that. I have great faith in the community, but it's just a wait and see. But everybody needs to pay attention to this so that we don't have a second surge. The problem is if there's a hot spot, we can go out and try to shut it down, but then the cat's out of the bag already. So those number of people that could be infected is huge if we don't pay attention fast enough. And it may even take a week to 10 days to really start to see those. And then by the time you get things shut down, it's another week before it completely blossoms. And so we will jump on that hard and fast. We have some infectious disease strike force teams that Katherine and the health department has put together for us. And that's fantastic. But we must be very careful and be very diligent about not spreading this virus, because it's going to be much harder to roll it back up than it is to continue to open up the city. So everybody, every citizen in this community needs to pay attention and abide by the rules.
And with the bad actors that you spoke of earlier, if an employee feels that they're being asked to do something that is unsafe, return to work with a fever or before they've completed a 14-day self-isolation period, is there a number or an organization that they should contact to report such actions?
Maybe
I would suggest they call the Lubbock Health Department, 775-2933, or they can call the City Council office, 775-2024. Let us know. We'll run the traps on that. We remember that these are the exceptions, not the rule. We've not had much of this, but Dr. Cook is spot on. If you're sick, don't go to work.
Okay, and that concludes today's news conference. And thank you all for joining us, and thank you to our panelists today. We'll see you back here Thursday at 11:30. So have a good week.